Waking up in the middle of the night to urinate might seem like a minor inconvenience, but it's a warning sign that shouldn't be ignored. While many brush it off as just part of aging or blame it on an extra glass of water before bed, the reality is that frequent nighttime urination, known as nocturia, can be a red flag for deeper health problems. If you're getting up multiple times a night, it's not just disrupting your sleep, it's damaging your overall health and could be signaling issues with your heart, metabolism, hormones, or even an undiagnosed condition like sleep apnea. One of the most obvious culprits is hydration habits, but it's not as simple as just drinking too much water before bed. Certain foods and beverages, especially caffeine, alcohol, and even so-called relaxing herbal teas, act as diuretics, forcing your kidneys to produce more urine and irritating the bladder. Eating water-rich foods like fruit or soup late in the evening can also contribute. However, if you've cut back on fluids before bed and still find yourself making those nightly trips, it's time to consider other explanations, ones that could have serious implications. Hormonal changes play a major role in nighttime urination, and this gets worse with age. The body produces less antidiuretic hormone, ADH, which is responsible for signaling the kidneys to retain water overnight. Without enough ADH, the body keeps producing urine at full capacity, leading to more frequent awakenings. Women going through menopause may experience a weaker bladder due to lower estrogen levels, while men face another problem entirely: prostate enlargement. As the prostate grows, it presses against the urethra, making it harder to fully empty the bladder, which means more frequent urges to urinate, especially at night. Beyond hormones, nocturia can be an early warning sign of serious health conditions. High blood pressure and heart disease affect the way fluids circulate in the body, often leading to increased urine production at night. Diabetes is another major culprit. Excess sugar in the bloodstream forces the body to get rid of it through urine, meaning constant trips to the bathroom. Even more concerning is the link between nocturia and sleep apnea. Many people assume they're waking up because they have to urinate, when in reality, their sleep is being disrupted by breathing issues. Sleep apnea causes fluctuations in oxygen levels, which triggers a stress response in the body and leads to increased urine production. If you're snoring loudly, feeling exhausted during the day, or waking up frequently for no clear reason, it's worth getting checked for sleep apnea. Leaving it untreated can lead to severe cardiovascular problems. Medications are another overlooked factor. Diuretics, often prescribed for high blood pressure, intentionally increase urine output, but if taken too late in the day, they can wreak havoc on sleep. Other medications, including antidepressants, muscle relaxants, and even some diabetes treatments, can affect the bladder or fluid balance. If you suspect your medication is making things worse, talk to your doctor. Timing and dosage adjustments could make a huge difference. The problem isn't just the frequent trips to the bathroom, it's the long-term consequences of poor sleep. Every time you wake up, your body is pulled out of its natural sleep cycle, preventing the deep, restorative rest it needs. Over time, fragmented sleep increases the risk of memory issues, weakened immune function, weight gain, and even higher chances of developing chronic diseases like hypertension and dementia. And as sleep quality worsens with age, the cycle only gets harder to break. The biggest mistake people make is assuming nocturia is just a normal part of life. While occasional wake-ups might not be a concern, frequent nighttime urination, especially if it happens more than once a night, should not be ignored. If simple lifestyle changes like reducing evening fluids or adjusting medications don't help, it's time to dig deeper. Whether it's an undiagnosed health issue, an enlarged prostate, or an unrecognized sleep disorder, addressing the root cause can improve not only your sleep, but your overall well-being. Don't just accept those late-night wake-ups as unavoidable. Your body is sending a message. It's up to you to listen.